Is community dentistry. Double pot method is used for disinfection, and if you see, the pH of normal drinking water is around 6.5 to 7.5. Concentration of fluoride in the drinking water is around 1.2 ppm, and if you see, concentration of fluoride in school water fluoridation should be 4.5 times of optimum level. Salt fluoride contains 250 ppm, and fluoride content of children's toothpaste is 1000 ppm, and the first community water fluoridation was carried out in Grand Rapids in 1945. Fluoride supplements should be provided to which age group? It should be between 6 months to 16 years. And the next question, backwash technique is used for defluoridation. Colorado stains is indicative of fluorosis. An educational talk which is delivered to students by high school teachers is known as lecture. And informal discussion between a small group is known as group discussion. And in an index of disease characteristic, to accurately detect variation in disease progression in either direction, this is known as sensitivity. And in a 3 into 3, the degree of freedom is, if you know the formula, D equal to n minus 1 into n minus 1. So 3 minus 1 into 3 minus 1, the answer is 4. And which of the following test is non-parametric? Non-parametric is like chi-square test. Standard deviation is a measure of dispersion. Next questions. When selecting samples from two groups in randomized controlled trial, bias is eliminated by all except, like in the answer, matching, randomization and blinding can be used to eliminate bias but not standardization. So answer is, so 80% specificity and 80% sensitivity of a test. Then in a population of 1,100 diagnosed as disease, how many left undiagnosed? So for this we have to find false negative, undiagnosed false negative. So sensitivity equal to true positive by true positive plus false negative is the formula we use. And in this true positive and false negative are 100 with a sensitivity of 80% means answer is 80. And since true positive is 80 and total diagnosed are 100, false negative are 20. And this is the answer. So scaleogram is seen in Dutchman scale, and kappa statistics are used for validity, and Russell's periodontal index is ordinal type. And which of the following is a parametric test? It is student t-test, and square root of variance is variance itself. And then which of the following sequence is correct? If you see, impairment followed by disability and handicap is the correct. And calibration of epidemiologists are done too. Why calibration is done is to have consistency of observations. And for applying DMFT index across all age groups in a population, which sampling technique is generally used? Stratified sampling technique. And Hawthorne effect is seen in randomized trials. Screening test should have high sensitivity. And equivalent step in epidemiologic study compared to examination in clinical practice is survey. And double blinding will help in avoiding both observer and subject bias. And the ratio of incidence of disease among exposed and non-exposed individuals is known as relative risk. And then next question is, what is the relation between endemic goiter and altitude? It is indirect causal. They are not directly related. Carryover effect seen in concurrent parallel studies. And number of demographic cycles of world population are 5. And the characteristic of test to detect the ones having disease is known as sensitivity. If you see, specificity will detect true negative, whereas sensitivity detects true positives. And if a test is negative and the patient has the disease, it is known as false negative. Death rate starts declining but birth rate is high. Which phase of population growth it is known as? It is early expanding type. Non-participating dentists in the Delta survey are paid at what percentile? For non-participating dentists, it's 50th percentile. The fee charged by most of the dentists in the area for the same procedure is customary. Global monitoring age for dental caries and monitoring disease trends is 12 years. And the study conducted on children in orphanages is Hopewood House. Xylitol resembles in sweetness to sucrose. And the justice is defined as it is a support fair treatment. In dental auxiliaries, non-operating auxiliary is dental health educator. Helsinki's declaration is related to ethics in human medical research, and the general norm under NRHM is 1 ASHA per 1000 population. And infected solid plastic waste is disposed in which color bins? And the answer is red color. Next questions.